So there are several changes I've seen in the 15 years of my internal medicine practice. Patients are less likely to blindly follow physician recommendations. Patients are paying more and more out of pocket, and as a result, they feel more entitled to negotiate the process. However, I think it's important to realize that simply making medical decisions to please a patient does not equate good medical care. Let's take something as like a colonoscopy, for example. So if patient X comes in and says, I do not want to have a colonoscopy, either because my insurance doesn't cover it, or B, I do not like the prep and those kinds of things, what do you do as a physician? Right? Do you continue to see that patient? Do you try to use other methods to get the patient screened? Now, fortunately, in this case, there are other methods you can use to try to get the patient screened. But the colonoscopy is considered the gold standard. So you want to push for that as much as you can. At what point do you say to the patient, well, you need to go and see another doctor because, we're not on the same page and I cannot continue to care for you? These are decisions that I think physicians have to make regularly with their patients so that it's clear that the expectations are well defined and documented. Document what was discussed, what the expectations are, what are you hoping to happen down the road? Meaning, if you send a patient for an examination or some kind of diagnostic test, do you have a system that would allow you to close the loop? I want to emphasize the importance of closing the loop because a lot of times we may see a patient in the office, you make some suggestions, you recommend something, you recommend a test, for example, whether it's a blood test, it doesn't matter what test it is, and the result may come back, but the next step is that somebody review it and some kind of communication happens, whether it's between the doctor and the patient or a staff member and the patient, and that is documented. That is what I mean by closing the loop. It's important to close the loop. Otherwise, things will get left undone.